1052. The husband of case number 1049. He's a 63-year-old male. On the day when the case number 1049 was confirmed, we arranged for him to go to the quarantine center. The following morning, he was asked to leave a deep throat saliva sample. Last night, he tested positive, so it's a confirmed case. He and his wife live in Block 5, Lei Mok Shu Estate. Every morning, well, he doesn't actually do much, but he will take public transport to go to the area near number 10, Tsuen Wan Market Street. He has a watch repair store there. He does repair of watches for others. It's a tiny little store that he would stack away at night. And then usually he'll bring with him lunch prepared at home, and he doesn't go anywhere else usually. He's not displayed any symptom. It's only with a test that the result came back positive. And then I read from news report for case number 1050 on the 10th of May. She had a meal with at the Modern China restaurant at Olympian City. It was just her and her mother. Otherwise, she didn't have meal with others outside. As for 1049, she didn't go into the market to visit the stores, but those were market stores near her home at Chuen Lung Street and Warwick Street, not in the market. And we have located those stores, and we have left deep throat saliva specimen containers for people there. And then today we have asked the housing department to help us with disinfection, or rather with the distribution of the deep throat saliva sample specimen containers to residents. So some may be out, so a letter has been left for them. So they could go to the estate management office of the housing department to collect their specimen containers. That's all from me. Dr. Sarah Ho, please, on the hospital authority. Good afternoon. As at noon today, in the past 24 hours, the hospital authority reported 14 cases. There are other cases already in hospital, so in total we have 68 patients still in hospital receiving treatment in isolation. For the past 24 hours, one patient has recovered and has been discharged. So far, 1,009 patients have recovered and been discharged. As at noon today, there are 39 confirmed cases in 11 hospitals. One is in critical condition, 3 in a serious condition, and 35 patients are in a stable condition. I already gave you the case numbers for these cases, for the critical and serious cases in particular. And then as at 9 a.m. today, the number of negative pressure bed 1,251, and then 637 negative pressure was same as yesterday. Occupancy rate is 40% and 54% respectively. If I may make an appeal here. Now we see there are quite a number of COVID-19 patients displaying mild symptoms, or symptoms like a common flu. Some may even have no symptoms. If patients think that it's not serious, so they won't go and see a doctor. And if unfortunately they've actually contracted COVID-19, then it could lead to serious condition. So if they don't go to see a doctor, they could form a transmission chain in the community. That's why I must remind the public to be careful. Don't dismiss it lightly. If they don't feel well at all, they must go and see a doctor at the first instance. Now you can go to the accident and emergency ward or our outpatient clinic, and we'll provide suitable examinations and checks for you and treatment for you. We do appreciate that during this time some may not want to go to a hospital, but actually we have already stepped up infection control at hospitals. If you wear a mask and you pay attention to hand hygiene, then you should go and seek treatment. You don't need to be worried. That's all by way of report. Now the floor is open to questions. Please raise your hand and I will pass you a microphone. Please first identify your organization before you speak. First, over there in the middle, the lady in the white vest. I'm from Hong Kong 01. First, yesterday, for Chek Ming Building and the market, how many specimen containers did you give out? How many were reluctant to leave their saliva? Are there any test results? Have anyone shown symptoms? And then for the latest case, 1052, that man repairs watches and clocks. So has he been in contact with any customers? Would you trace those customers? Maybe they need to do tests as well. And then the third question. Experts have expressed concern that people just, don't leave their saliva specimen properly. They do it rather casually. So have you found this to be the case? How can you ensure that the test results will be reliable? Now, at Chek Ming Building, we left behind 47 specimen containers. Some were not home, so we just left the containers with the owners' corporation, and then we'll follow up with them to see if people would leave behind their diphtheral saliva samples. For the case number 1052, that watch repair store, while the patient said business was not particularly good recently, he may have some customers, but there are no receipts or invoices on which we could use for tracing the customer. So we see how we can trace the customers. As for leaving specimens, the hospital authority has made a video to show people how to, leave the sample. Are there any test results yet? No, there are not results yet. This is on the second row, the gentleman in green.
Can you clarify how many people relevant to this new family cluster has been tested so far, including perhaps in separating family members and residents who live nearby in the relevant buildings? Secondly, with regard to the announcement that the Department of Health is going to test airport staff starting on Friday, is there if the scheme is not mandatory, then what good will it do to help limit the spread of the virus at the airport? And if staff are only tested once, they can get infected after getting a clear result. So how accurate or representative is that going to be? Thank you.
Mm-hmm. So we have quarantined those close contacts in the quarantine center, or those with symptomatic, they are now staying in the hospital. So if they can be discharged from the hospital, they will be quarantined in the quarantine center. That amounts around, I think, around 20 or less than 20, fewer than 20 close contacts altogether for the 3 cases. And we have distributed, so far we have distributed more than 100 salivary bottles to those who might have some non-close contacts, or actually some of them do not have contacts with these 3 cases, to understand the situation. And we are planning, today we are through the housing department, we are distributing the salivary bottles to the over 800 units who live in the Lei Mok Shu Block 5 at the residence. So that would have more than the number of residents in terms of thousands. But so the airport staff, we are doing the testing and distributing of the bottles and testing since Friday, because they are all asymptomatic. So this is a voluntary testing to help us to understand more about this high-risk group, whether they have indeed have higher or any cases that could be found among this group. So the further, whether we need to further test them depends on the testing results. Testing of asymptomatic persons, exactly, you mentioned about the difficulty of testing of asymptomatic persons, because you don't know whether you should, how long you should test them, and you cannot continuously test a particular group of people. So it all depends on the test result we can get in the initial after we get the initial results, we'll know the preference among this group of persons. So, actually, we would like, just like what Dr. Ho said, we would like to appeal to the public, including those, especially those who work with a lot of people or a lot of travelers. If they develop any mild symptoms, they please go to the doctor and seek testing. Yeah.
Over here on the second row, I'm from Oriental Daily. Now, you mentioned that you gave out specimen bottles to 47 specimen bottles to Chek Ming Building. How many bottles have you sent to Lei Mok Shi Estate? And have you checked the units there to see that the drainage system is in order, so it won't be another case of Hong Mei House? Now, WHO said that even if there is a vaccine, this disease is not going to go away. So would it become an endemic disease? If that's the case, how do we adjust to that, and what is your view on that? And then for the Charming Garden case, maternal grandmother, is she a confirmed case? That's all.
Well, yesterday we went to Chek Ming House and distributed 47 specimen containers. And today, through the housing department, we will arrange for these containers to be distributed to the residents in Block 5 of Lei Mok Shi Estate, because there are quite a number of households, about 850 of them, 850 household units. Over 800 of them. So in each household, there might be 3 to 5 persons. So there will be over thousands of residents there. So we have to make arrangements, and the containers will be distributed to these residents as soon as possible. In Tai Kwok Choi, the maternal grandmother, she has gone to the quarantine center, and up to now, the test result is not out yet. And she's not showing any symptoms right now. A lot of experts, for instance, from WHO, have said that COVID-19 may not disappear altogether. So we may have to accept the fact that this will go on or will coexist with us. So what will happen in the future, the development of the virus, we still have to observe, because this is new to us. We have to see whether the outbreak will occur one after another, or will there be spikes and upsurge of numbers and sometimes reduced numbers because of seasonal changes. We still have to observe. What about any plans? Have you sent any people to the confirmed cases homes to look at their drainage pipes? Well, if there are outbreak clusters or connected cases, then we would cooperate with other departments to see if there are any problems with the drainage pipes in their household. If there are problems, then they could report to the relevant authorities and to see whether these could be repaired. Over there, please. I'm from Apple Daily. I'd like to ask about the store in Tsuen Wan. Is it in Market Street? Do you have the exact location of that watch repair store? Did he wear a mask while he was at the store, and or would there be occasions that he did not wear a mask while talking to people? And also, for the close contacts of the grandmother, have they shown negative test results? That is, except her husband and her granddaughter. The other members in the family all showed negative results. And also, have you further information about where the source could be? In the neighborhood, were there any confirmed cases in the past? There might be asymptomatic patients with long incubation period, could there be positive sources? And also about the store and the 2 blocks, you mentioned that there will be testing conducted. I'd like to ask for these 3 places, how many people will undergo testing and how many containers have you distributed? Did anyone refuse to do the testing? For Market Street, that is case 1052, the makeshift watch repair store, it's underneath Chek Ming House. Well, according to what he said, he had worn a facial mask all the while. As regards 1049, case 1049, her family members at that time, there were 8 of them, 8 close contacts, and among them 2 are confirmed cases. For the rest, they have undergone testing, and the results showed negative results. And there are some with symptoms, so we have to wait till they recover and before sending them to the quarantine center. We don't know about the source of the infection yet. We know that there are home clusters, there are a couple, and then with a granddaughter. But then because they had no travel history in the past and they had no contact with high-risk persons, so we have not been able to identify the infection source. We are trying to expand the tracing scope. We've tried to find whether there are people that are not close contacts but might be the source of the infection. For Chek Ming House, we have distributed 47 containers. For the 3 market stores, we have distributed 15 containers. For Lei Mok Shi, there are over 800 households there in the Lei Mok Shi estate. Of course, we hope that all residents will return the specimen containers to us, but then this is a voluntary basis, so we just started distributing the containers today. We have to record their information, and we have been distributing the containers through the housing department starting from this afternoon. For Chek Ming House, some of the residents were not at home, so we've left the containers to the owners of corporations. We hope that through the OC, the containers could be distributed to the residents. Next, over here, please.
On this latest case, 1052, can you just tell us a little bit about what you're doing for contact tracing with him in terms of the transport he took and the shop that he was running? Are you appealing for people who may have used those facilities to come forward as well? And secondly, in terms of tracing the source, one of the suggestions was maybe it could be from someone who'd returned from overseas. Is there a need to reconsider maybe how long the quarantine period is for people?
So, as the recent case, he stayed in the quarantine center before he came to be a positive case. So there's no additional close contacts that need to be quarantined because his close contacts are mainly related to his family members. We understand some public may have patronized his shop during the incubation period. So we plan to see how we can trace them. We may ask other government departments to help whether they can have any clues to help to trace. Yeah, if the public recall that they have visited this shop under Chek Ming building, they can call our hotline, or if they develop symptoms, they can attend general outpatient clinic or A&E department, or even they can, if they do not have symptoms, if they give out this history, I'm sure the doctors in both the private and public sector will be willing to give out a test for him.
Next, please, on the 3rd row. I'm from Mingpo. Are there any loopholes in the quarantine system? Some experts said that 14 days may not be inadequate. Some people, the incubation period may be longer than 14 days. On the other hand, some experts said that 14 days could already cover 99% of the cases. I wonder what CHP thinks. The remaining 1%, if there is someone falling within this 1%, and what is the percentage of this person being the invisible transmitter of the disease? And also in Hong Kong, what are the loopholes do you think are in our quarantine measures right now. My second question is, you mentioned that WHO already mentioned that COVID-19 may not disappear in the coming years. We may have to coexist with it. So I wonder what hospital authority or SHP have in mind, any plans of how we could coexist with COVID-19. I understand the hospital authority is going to resume some services. But with this recent situation, does it affect the implementation of your plan of resuming these services in hospital authority? And also, there was a mention that about a testing formula. There are about 48% that the result have not been reliable. Is Hong Kong using this kind of testing formula? If yes, will it be reused or replaced? For the present cases, we understand that there are most of them are from overseas, from the US, the UK, Pakistan. These are mostly imported cases. We are now doing 14 days mandatory quarantine, and after they've arrived at Hong Kong, they have to give us their deep throat saliva specimen. They have to wait till the testing result is out before they could be released home. And we will distribute the containers to them, so even if they've gone home, they have to continue to collect a saliva specimen and give it to us the second time. And this is to try to see if there are people who may be in imported cases that may have a long incubation period. So all these surveillance measures, no matter how many testing we've conducted, it's impossible to be 100%. There could be possibilities that some people may have long incubation period, and there might be cases that we have overlooked that. What about 28 days of quarantine period? But we have to strike a balance to. So we just are trying our best. Well, whether we have some invisible transmission chains within the community, we still don't know, because there are some asymptomatic patients. There might be invisible carrier of the virus, and if the person go to the doctor, then we may be able to identify him. However, if these patients do not go to consult the doctors, we do not know that there is such transmission within the community. So it's impossible to really have it all eradicated in our community.
On our service volume, well, at one stage we had to watch closely the developments of the epidemic, and then we also have to balance the risk of infection control. We have to consider our manpower level and the availability of personal protective equipment. So we have to consider all these factors before we will slowly resume the non-emergency services. Now, you mentioned test kit. Actually, we do not use that test kit for now, at least. Of course, we'll find out more from our colleagues about the situation with the test kits, and we also watch closely the test results and the flow, the workflow in our laboratory. So these are the measures we've been, keeping all the time. And from now there are again confirmed cases. So would it be better to not resume classes? And what can be done at school to prevent an outbreak? Second question, last week there's a relaxation of the gathering ban. So what are the factors to consider for you to tighten the restriction again? Now, for case number 1052, on the sheet you gave out, you said its age is 62, but then you said 63. Well, I may have to check the date of birth. He said 62, but maybe we have to check the date of birth. Perhaps later on, you can check in the press release that should be accurate. Now, on gathering ban, I understand the secretary just answered a similar question on another occasion, so I won't repeat the answer. On the fourth row, please. I'm from Hong Kong Economic Journal. It's about case number 1052. You said that he runs a mobile watch repair store near the Chinwan Market or at Chinwan Market Street. Now, when it was the peak of the epidemic, say in between March and May, was he still operating his store? Now, of course, he is an asymptomatic case, but he probably has more chance to come in contact with outsiders. Could he actually be the source of the first infected person? If so, how are you going to trace the non-close contacts of him, including nearby store holders? Now, it's said there's now a silent transmission train. We can't rule out a community outbreak, but then some experts say there have to be more clusters before we should put a hold on class resumption. So how do we assess the epidemic now? If there is just this one cluster, does it mean that we don't need to be too concerned at this point? Another question for the hospital authority. Some recovered patient said that she is really worried that his illness may come back. He dares not go meet with friends. So apart from Chinese medicine treatment, would you consider giving other follow-up support for such discharged patients? For case number 1052, we understand that he's been operating his store all along, though business was not that good. And even though it's called an itinerant store, is actually fixed at the location. Now, because he shows no symptoms, there is no onset date. But of course, we will count it from, on the basis of the time when he's tested positive, so we could work out his incubation period or infectious period. But then we couldn't rule out the possibility that he carried the virus earlier. And could it be actually the first case? We won't be surprised if that's so. And then for the girl, the tutorial school or the paternal grandmother, where she lives, and or the vegetable store and so on, whoever we could find, we will try to find them, all these contacts. And for the case number 1052, customers that patronized him, like people asking for a battery change of their watch or whatever, we will try our best to trace them. We'll see how it comes out. It seems that there are no other similar stores there. Well, when a patient is discharged, of course, the patient may face various issues or may have various needs. We do fully appreciate that. So usually when a patient is discharged, we arrange for a follow-up consultation. We'll set up an appointment. Apart from that, we also provide other support. For example, there could be clinical psychology, clinical psychologists or other people, or there could be patient support groups and so on. So if a patient after discharge has certain needs, the patient could tell us what the needs are, and then we will try to make arrangement. And usually if a patient doesn't tell us, but then if our colleagues observe that the patient may have certain needs, we'll actually consult the patient, and then we will refer the patient to the relevant section or group for assistance. So if a patient has any needs, the patient could come in, should get in touch with our colleagues, and we'll see what we can do to help. Sorry, speaker's not coming through. Sorry, speaker's not using a microphone. Now, in the follow-up consultation, the patient could tell us whether there are any clinical symptoms. And then the doctor will look at the symptoms. Usually we'll do X-ray examination. For certain patients, we might even take blood samples. So it's like, putting together blocks, and then the doctor will have to make a clinical judgment and decide if further examinations are required. In the middle there, the lady in white. I'm from Cable News. For the new case today, what is the viral load like for this patient, because he has no symptoms? So could it be a possible source of infection? And then some experts said that if for 28 days there is not a local case, then that's an indicator to show that the epidemic is brought under control. But then today the WHO said that it could become an endemic, so the disease will stay with us. So does the Center for Health Protection have a new indicator to tell us under what circumstances could we consider the epidemic to be under control? For case number 1052, the CT value was rather high, 30-something. And that CD value may vary. It may be higher or lower at other times. So we have to see if there are other samples for us to look at the CT value. But we don't rule out the possibility that he's been carrying the virus for some time. So we'll be therefore doing investigation in that direction. And we'll see if he's been in touch with, has been in contact with customers and whatever. We'll check that. No, actually, there are no indicators to say when the epidemic is under control. We mentioned 28 days is because we've made reference to other infectious diseases. Maybe so 2 incubation periods, 28 days. If there are no local infection case, then maybe we could consider the situation to be under control. But for imported cases, well, some experts say because we have full total control of imported cases, so we shouldn't look at that. That's why we should just look at local cases. So generally, it's accepted that we could look at that to see whether the epidemic is under control. Now, for some time, we've seen no local cases, but after 20-odd days or so, we're seeing local cases again. So there could be silent transmission change in the community. It's possible after some time the disease is still being spread around, just that we don't detect it. So that's why we need to have monitoring system. That's why everyone has to watch his own condition carefully, and if someone feels unwell, he must see a doctor at once. Now, we don't see cases, but they may not reflect the true picture in the community. It's only because the people are asymptomatic. On the question of endemic, well, in other places we're seeing major outbreaks. So and there are so many places with major outbreaks. So if every place has to control the epidemic to the point that they have no cases, and well, and also different places may have different monitoring systems. So it's difficult for us to achieve that around the world. Now, for us, we have 1,052 cases, some 200 cases asymptomatic, and that means there is a much bigger proportion possibly. And if that's the case, also the case around the world, it's really hard to control the epidemic. That's why we're saying that perhaps this will stay with us.
The lady in the middle. First, about the standard that whether the epidemic is being contained. Some experts say that the 28 days of 0 case is not practical because it is impossible to have a completely 0 case during a period of time. How would you judge whether the epidemic has been controlled? There are some cases that have no clear source. Apart from their family members, the girl had been to Olympian City and to the tutorial center. Are there any close contacts that have to undergo quarantine? Also in Chek Ming House, there are some premises. There are some sex workers' premises in Chek Ming House. Well, there is no standard as regards how we could decide whether the epidemic has been completely controlled. We perhaps have to discuss with experts, and we will also draw reference from different experts to see if it is possible to draw a line or make a definition. Well, there are unidentified source patients. The infection is only among family members. However, the source is unidentified. This is a local outbreak, local case. For Chek Ming House, residents in Chek Ming House, what sort of profession they do, it is irrelevant. We just will give them the specimen containers and see the test results. The lady over there. I'm from RTHK. About this granddaughter, 5-year-old, after having a meal with her family members, what about other family members? Are they still not showing symptoms? And also some experts mentioned that for this cluster, There might be people who have longer incubation periods than 14 days, and it could be possible that they have already spread the disease in the community. Yes, the girl lives in a charming house with her family members. They are close contacts. We have already sent them to the quarantine center, and we will arrange for them to undergo testing. Within 1 to 2 days, the results will be out. What's the second question? I'm sorry. Yes, the source of the infection. Oh, well, for imported cases, well, sometimes there might be a silent transmitter, and also there might be local groups who have already undergone a quarantine period. However, they may be asymptomatic patients, and they are still carrying the virus, and they could be the source. There could be different kinds of possibilities. Well, in that case, do we need to tighten up our measures? There could be possibilities that the virus would be spread in a silent form. Well, for home quarantine, there are over 100,000 odd of them. And for 599C, 599E, there are quite a number of them under home quarantine. So it is impossible for us to send all the close contacts of these people to the quarantine center. Home quarantine is another way to solve the problem. So there are also mechanisms for us to monitor whether they stay at home. We think that the present measures are appropriate. Last two questions. I'm from AM 730. Well, for 1052, in addition to attending his watch repair store, did he go to any other places? What sort of public transport did he take? And also his customers, how risky they are. For instance, for those who take their watches for repair in his store. Any other close contacts? And also for the market stores, it was mentioned that those persons had been to the markets. And what about the people in the markets? Did they wear face masks in the market? And what about the risk of those people in the market of contracting the virus? And also about the girl, she went to the tutorial center. Did you go? Did you send out the containers, specimen containers, to the teacher and also other customers in the tutorial center? And also for Chek Ming House, in addition to the residents in Chek Ming House, what about people having gone there? Is it possible for them to get containers from you? Well, for the people you just mentioned, they are not close contacts in our definition. Well, in the past, we had over 1,000 odd cases, and we find that if they wear face masks, they would not be a high-risk group, and they are not close contacts of the confirmed cases. We have not many cases right now. We have only 1 or 2 local cases. So we now would hope to expand the surveillance scope and to see how the situation is. In the past, we may not have the chance to do that, but now we do have this chance to expand the surveillance scope, and then we could see how the situation is. It doesn't mean that the risk is higher. Well, for those who are not close contacts, the risk are not particularly high. But of course, there might be something that they have used in common. For instance, paying money or touching some specimen excretions, etc., or didn't wash their hands and then touch their eyes and nose, etc. These are possible that the virus could be spread. Well, we have seen cases like this overseas. However, relatively speaking, they are not high-risk people when compared with the family members living in the same homes. So we would try to look at the people in the residential area and also see do some surveillance in the places that they frequent. For instance, in Chek Ming House, we would try to collect specimens from the residents in Chek Ming House. We will wait till the results are out. If there is anything extraordinary, we will then decide whether we need to expand this surveillance scope. For the tutorial school, because it's open on Saturday, there are 6 containers that we have distributed to the teachers, and also people accompany the children to the tutorial center. Last question, please, in the middle, the lady over there. About the specimen containers, how do you distribute them? You just leave the containers in front of to the containers, or will you teach them how to get the saliva specimen? And also for those who have returned the containers to you, how many of them have done it really properly? Because if the specimens are not collected properly, then what is the possibility of having a correct or accurate testing results? And what are the measures that you have in place to follow up on those who have not given you their specimen properly or who have not collected their specimen properly? We have containers, we have the form and a letter given to them. We will, on that, we will teach them how to collect their specimen. If they still don't know how to do it, there is a hotline. They can call us, and we have staff teaching them how to collect their saliva specimen. Well, this is a monitoring system. We will try to see whether we could use this method to monitor the situation. We have this in the airport, in also private clinics, etc. Of course, there might be possibilities that people have not collected their saliva specimen properly, and the testing results may not be accurate as a result. So for those who are carrier of the viruses, it is not difficult for them to get the specimen and then to have the test result accurate. That's the end of the press briefing today. Thank you.